right with you? Could you please confirm your current name for me? Okay. Just to introduce myself, I am Dr. CalmingEscape. I am the plastic surgeon that is going to be working on you. Yes. So, have they explained in detail what exactly you're doing here with me? Well, they usually leave it up to me, so I'm used to it. So, you have been placed into the witness protection program, is that correct? Of course. So, because of the degree and the level of your case, so to say, they are very interested in changing your look completely. Yes, there are, of course, levels to the witness protection program. They will be relocating you, changing your name, starting your life over essentially. But they want to take it a step higher with you, and they would like to fully change your look. So that's where I come in. I have been a plastic surgeon for many years and have started to recently team up with the witness protection program to alter people's outward appearance. Yes. By the time you leave my office, you will no longer look like this current you, but instead the new you that the program will create for you. Do you have any questions? I'm sure you do. So, I mean, you don't honestly have much of a choice, unfortunately. I mean, you could talk to your caseworker, but on my end of things, I'm really just here to get an idea of how we can help you. Okay. And do you know your case number by heart? Okay. Well, I just want to make sure I'm really working on the right person here. So, to start off, I would like to touch your face, get a feel for it. Then I am going to be measuring your face, your features, your head, your skull, things of that nature, and then we'll decide what look is going to be best for you, what procedures we can do. Some people go with simple Botox injections or facelifts, things of that nature. Others will go for a nose job to switch up their look. And then, of course, we have the extreme level where we completely reconstruct your face to look like a completely different being, if you will. So we'll see what degree and level is best suited for your case. Okay, so I'm just going to be touching your face. And have you had any sort of plastic surgery in the past? Alright. Not to worry. Well, you do have great skin quality. I mean, I like to be honest with my patients. You are rather attractive, so unfortunately, to completely change your look, we may have to put you on the opposite end of the spectrum. Currently, you are attractive. You know, people would find you to be good looking, pretty, whatever you want to say. So to successfully hide you, we may have to, I don't like to use the term ugly, but we may have to adjust you to a different end of things. Yes. Okay. Do you wear glasses or contacts? Right. Any sort of oral surgery that you've had? Yes, sometimes we change up the teeth and the mouth as well, so it's good to know these things. Exactly. Okay. So now moving on to the measurements. As I said, I'm going to be measuring your facial features, your head, things like that. Is that okay? Okay, good. Alright. So I use a old school measuring tape for this. We do have a more, modernized scanner that would kind of scan your facial features for us. However, considering you are in the witness protection program, it would not be wise for us to leave any sort of digital documentation of you or the changes we are going to be making. So we are going old school with the measuring, as well as the files will all be kept just in my notebook and will be destroyed after your operations are completed. Okay. So I'm going to get your forehead to your chin to start. Okay. Okay. Now, ear to ear. Okay, hold still. And we're going to also do temple to temple. Yes. Okay, so we're just going to... Okay. And moving down the end of your jaw. End of your jaw. Relax your jaw. Now, specifically the length of your eyebrows, both of them. So we'll start here on your right side. And your left side here. Yeah, they are roughly the same, but no one's face is symmetrical, so I do like to get both. Yes, especially if we're going to be doing, any form of surgery, injections, anything of that nature. I need to know the exact details for each side of your face. Okay. Moving on to your cheekbones. Both sides once again. So your right side here. And your left side over here. Okay, interesting. Now your lips. So for this, I will do from side to side, bottom to top, and then I'll also have you like that, and I'll kind of get the curve of your lips as well. Okay, so starting off side to side, just relax your lips. And just to be on the safe side, can you smile for me so I can get that too? Okay. Now I need you to just kind of slightly open your mouth so I can get the curve of your lips. Mm-hmm. Now, your eyes, same thing. We'll be doing side to side, down, up, both sides. So. Okay. Okay. This side. Mm-hmm. Now just close your eyes for me. Okay. I'm just gonna get a little bit of your chin here. Good. Okay, moving down, relax your neck for me. I'm going to get from your jawline down to your shoulder of your neck on both sides. So, from here to here, and the same on this side, from here to here. Okay. So the next measurement that I need, I am going to just kind of stand up around you. I need the circumference or around your neck, and same for your skull. So I'll do 3 different ones for your skull. I'll wrap around about here at your chin, around your head. Same for at your nose, around your head, and then at your forehead, around your head. Okay? Alright, so I'm just going to stand and get a little bit closer to you, if you don't mind. So, first, let's go ahead and do your neck. Okay? So, okay, and then moving that up, we'll put that right at your chin and around your head. And moving that up your nose. Yeah, just like that. Good. And then up again to your forehead, circumference of your head. Okay. So, after taking these measurements, you do have a very normal but attractive face, as I said. So we will most definitely need to tone that down for you so that you blend in, not with, say, the normal person, but no, I wouldn't say that we're going to make you a plain Jane or anything like that. Your caseworker had something a little bit different in mind. Perhaps something that would scare people away so that in the long run people would not want to be around you. In the long run you would not get the attention because you would be quite frightening. Yes. So I do believe that myself and your caseworker have come up with 1, 2, 3, 4, 5, 6 different potential looks for you. Now, you're not going to look exactly like this creature. Oh, no, not at all. But you will be inspired by them. So there will be bits of you still left in there, but we will highlight your facial features, your lips, your chin, your nose, your cheeks, your eyes, your brows, even your ears, to reference or be influenced by the specific. Yes. Alright, so let's go ahead and give you some options, because although you don't have much of a choice in this, operation, it is for the greater good for you and your loved ones. But we do want you to have a little bit of a choice on what your end result will be. So I do have some photos for you to reference as we kind of decide the direction that we want to go. So as I said, some of these may be a little startling, but in the long run, it will keep people away from you and will make you a little bit more of an outsider, so people won't necessarily be looking for you. Okay, so first up we have inspired by the creature, which is creature from the Black Lagoon. Are you familiar with this character? Okay, well, so this is the creature from the Black Lagoon. Yes, like a gill man, you could say. You're very inspired by aquatic life. So for this, I would most definitely enhance your lips. I'm going to make them much bigger, which is popular these days anyway. And then we're going to make your eyes pop. Quite literally. I would like to remove some of your eyelid and just make your eyes quite enormous. And then we can also add features along your cheekbones, your ears, the rest of your face, your neck and collarbones that kind of resemble the gills. So what are our thoughts on that? Okay. Okay, so next up we have Samara, which this is inspired by the Ring movies. This is Samara. Yes, childlike, but at the same time quite frightening. Yes, so definitely would be, instead of hiding or trying to, pull away any of those wrinkles, we're going to add some in, kind of age you in a way that is a bit creepy, because on one hand you will still look like a child, but on the other hand you will most definitely look like your skin has been at the bottom of a well for a while. So that will definitely add a creepy aspect to your new look and make people not want to speak to you. Okay. Next up, we have, just grab it here. There we go. So next up we have the option of a Freddy Krueger inspired look. Now, do not be alarmed, we're not going to burn your face or anything like that. We would simply add details along your skin to kind of resemble the marks that Mr. Krueger here has, but no, we will not be burning your skin whatsoever. Yes, I mean, it will have almost like a plastic look to it, you could say. Not much movement, I wouldn't say, no. No, not too natural. Okay. And then next we have, this one is a bit more emotionless, you could say, and that's the Michael Myers look. Yes, so for this we're going to, you could say, smooth out the features altogether, because it's one look. There's not, contoured cheekbones or anything like that. It's very, subtle, so we would do that for you. We would also take reference to, of course, Captain Kirk for this, considering that's where the mask came from. Yes, William Shatner. So we would take references to both that to kind of soften and blend all of your features into one look. Sink back the eyes a little bit. Of course, we won't be putting you in a mask, but we want to give that illusion. I mean, we could add a little bit plumper lips. I'm not entirely sure what it would look like with the Michael Myers look. I'm kind of picturing Michael Myers with like Kylie Jenner lips, and that's an interesting thought, but we can see what works best for you, and we do want to take your opinion, of course. Okay. Next. So this one is a bit more, out there. You may scare a lot of children with this look, and that would be the Pennywise look. Now, see, I'm partial to the Tim Curry Pennywise, but we do have the newer version as well, if you'd prefer. Now, for this, we would actually make sure that your skin is this white, pasty look. Same with the red of your lips. Yes, and your nose, we could actually surgically put that clown nose there. And then for the rest of the top of your head, we would remove the hair follicles on your scalp to give that full Pennywise look. Okay. And then our last one, you could say it's a little bit more lighthearted. It is not going to get you a lot of friends, however, but it's a little less scary than some of the ones that I have just shown you. And that would be one inspired by Shrek. Yes. Are you familiar with that movie? So we are going to make your jawline a little bit bigger, your nose wider as well. Same with a little bit of your cheekbones. Just Shrek has a very wide face, and you kind of have a more slim face, so we definitely want to make that wider. Same with your features. Your eyes will be a little bit bigger. Okay. And then we will talk about adding the, what would you call them, antennas off of his head. That's not the right word, but they won't work as antennas for you anyway, so we'll kind of work with what's best for you. How does that sound specifically? Okay. Make those notes. Okay, so those were really the only introduction questions and things I needed from you. We went over exactly what is going to be happening. I took your measurements, and then we went over some of the ideas. Now from here, you are still in protective custody, so you have nothing to worry about. In the coming days, we will make the final selections of your new look. Myself, your caseworker, and you, I promise you will have some input as well. And then we'll start the procedure. Depending on what we decide, it may be one procedure, one operation, or it may be multiple. I want to make sure that you are safe at all times, because this is not exactly the common plastic surgery that you would have like in Hollywood or anything like that. No, it's quite extreme, and so I want to keep your safety and your health at the forefront. Yes. Do you have any other questions for me? Alright, well, it was lovely to meet you, and as I said, I will be seeing you quite often in the coming days as we make the final selections and we start to work with what the best medical and surgical plan for you is. Okay? Alright, well, you have a lovely evening, and I will see you tomorrow. Bye now.